Hi everyone, my name is Tiana Stussy and I am a rising fourth-year undergraduate student at The Ohio State University. I am working under Dr. Jeffrey Wing of the College of Public Health and alongside doctoral students Jonathan Powell and Jenna Rychek. Today I'll be presenting on the association between increased outpatient facilities and the prevalence of Alzheimer's disease and related dementia in rural counties. An estimated 6.2 million Americans aged 65 and older have Alzheimer's disease. Older adults living in rural counties are at increased risk for developing ADRD due to behavioral, occupational, and environmental factors that are unique to rural regions. However, at the same time, these individuals face more healthcare barriers compared to those individuals living in urban counties. For example, rural residents may have limited access to the healthcare resources needed for ADRD diagnosis. Our study hopes to help in addressing this healthcare disparity by providing a descriptive analysis of services offered by drug and alcohol abuse treatment facilities in Ohio and their associations with ADRD prevalence in rural counties, and if these associations differ by Appalachian County designation. This study used a cross-sectional ecologic study design of secondary data to analyze the association between services provided by drug and alcohol abuse treatment facilities and ADRD prevalence in the 24 defined rural counties. Data from the 2020 National Directory of Drug and Alcohol Abuse Treatment Facilities was used to examine services offered by various facilities throughout Ohio. The Centers of Medicare and Medicaid Services Geographic Public Use Files from 2018 was used to determine ADRD prevalence. And the Robert Wood Johnson Foundation's County Health Rankings from 2018 was used to examine smoking and excessive drinking prevalence. The results we found are highlighted here in red. As you can see for Model A, with each additional outpatient facility, the county-level prevalence of ADRD is 0.4% higher. After adjusting for smoking and excessive drinking prevalence, as we did in Model B, this estimate remained consistent. We saw similar associations with higher county-level ADRD prevalence as counts of outpatient detoxification facilities and general hospitals increased. Model C was used to see if there was a differential association between services offered and ADRD prevalence in Appalachian rural counties versus non-Appalachian rural counties. It was found those living in a rural non-Appalachian county had a 0.55% higher county-level ADRD prevalence compared to those living in a rural Appalachian county. A similar association was found when we increased the count of facilities that administered or prescribed medication for alcohol use disorder. However, rural non-Appalachian counties had a 1.29% lower ADRD prevalence compared to rural Appalachian counties for each additional facility that accepted clients using medication-assisted treatment for alcohol use disorder prescribed elsewhere. The fact that counties with more outpatient facilities also had higher county-level ADRD prevalence led us to believe that additional healthcare resources allows for individuals to have more points of contact in the healthcare system, which can in turn lead to improved detection and diagnosis of ADRD. Therefore, ADRD rates may be underestimated in rural counties, as individuals in rural counties face barriers in accessing care. Our study helps show the importance of having healthcare resources available to residents in order to diagnose ADRD. To address this healthcare disparity, policymakers can pursue policies aimed at improving the infrastructure and access to healthcare resources in rural counties. Furthermore, future studies can be done to support the claim that more healthcare resources lead to better detection and diagnosis by looking at healthcare resources of rural counties throughout the country and by looking at data sets of different health conditions. Thank you so much for listening to our presentation today. Should anyone have any additional questions, I can be contacted by email at stussy.1@osu.edu.